everyone. Welcome to this session. My name is Srinivas Sampath. I'm the Director for Urban and Water Business within ADB's Southeast Asia Department. It's a pleasure for me to welcome all of you to this session. And as a moderator, I wanted to just put out some initial thoughts on this session. The key question that we'll be discussing during this session is, what are the hurdles to achieving universal sanitation and how we may overcome that? This is a very important issue for us to discuss because even today, 1.14 billion people around the world don't have access to adequate sanitation. The sanitation gap needs to be closed, and this is a very important SDG agenda as well. So during the course of this presentation that we would hear from speakers, we will look at a number of solutions that have been proposed. And we will also be looking at how we would be able to get some blended approaches, including output-based aid and blended finance during the course of the presentation that we would have. I would also like to acknowledge the rapporteur for this session, the young water professional, Kumaresan Panir Selvam, the graduate student from Indian Institute of Technology, for the support he's extending in reporting back on the session. There will be an opportunity for the participants to ask questions. So kindly note that there is a Q&A panel on the right-hand side, where you can post these questions. Each of the speakers will be given 10 minutes. So we'll really request the speakers to stick to that 10-minute slot so that we can wrap up the session in time, but also leave enough time for the question and answers that the audience may have. So with that, let me start with the first presentation. Let me invite the first speakers. So this session will focus on leveraging resources for improved household sanitation through output-based aid and blended finance. This presentation being done by USAID will provide us with an example of the work that is being carried out in the Philippines. The presentation would be led by Joanne Dulce, who's a WASH lead in USAID Philippines. Presently, she manages Safe Water, USAID's 5-year initiative to improve water security for vulnerable and underserved communities in the Philippines. Joanne carries over 20 years of development experience working in the water sector and also climate change and energy sectors in the Philippines. Her colleague, Doreen Erfe, is currently the resource mobilization specialist at the USAID Safe Water project. He manages policy and governance-related initiative of project focusing on financing and regulatory reform in water supply and sanitation and capacity-building activities to improve access of local government units and water service providers to financing. Prior to this, she served as the Senior Policy and Institution Development Specialist of the USAID Philippines Water Revolving Fund Support Program and Senior Policy Development Specialist of the following program. So the floor is yours, Joanne and Doreen, to start the presentation. Thank you.
Thank you. Thank you very much. Good afternoon. On behalf of the United States Agency for International Development, or USAID, I thank the Asian Development Bank and the Asia Water Forum organizers for giving us the opportunity to share our experience piloting the output-based aid and blended finance, or OBABF, to increase household access to sanitary toilets. I also acknowledge the support of the local government units of Sagay City, Negros Occidental, and Alabel Municipality in Sarangani, DAI, Water.org, ASA Philippines, and Negros Women for Tomorrow Foundation for their strong partnership in this endeavor. Next slide, please. While the Philippines surpassed its Millennium Development Goal targets in 2015, the reality is that some 25% of the population, mostly from poor households, still practice open defecation or use unimproved toilets. Also, about 90% of Filipinos still do not have access to septage management services or sewerage facilities. To achieve universal coverage of sanitary toilets and septage management services by 2030, the Philippine Water Supply and Sanitation Master Plan estimates that about $112 million in investments is needed yearly. Any delays would add cost to this investment, so time is of the essence. However, sanitation investments have been particularly nil Investments in wastewater treatment, for example, are estimated to increase at only 0.2% per year of the national budget and are concentrated mostly in urban areas. Research studies have well established the economic cost of inadequate sanitation. Waterborne diseases consistently rank among the country's top 10 leading causes of morbidity. Data from the Philippine National Nutrition Survey have shown a strong correlation between growth stunting and poor sanitation services, where 2 of every Filipino children are reported to be stunted. Overall, inadequate sanitation costs the Philippines about $1.4 billion each year, of which 72% is attributed to loss of productivity and healthcare costs, 23% from economic losses from water pollution, and 5% from effects on dignity, safety, and gender equality related to lack of sanitation. But while data underscore the urgency of improving access to sanitation services, the question remains, why is sanitation access still low? We identified 4 key constraints that indicate: 1, poor households cannot afford building their own sanitary toilets; 2, sanitation is a low priority when allocating public resources; 3, the enforcement of sanitation policies and standards remain weak; and 4, there is a lack of awareness and appreciation of the social and economic value of sanitation services. Next slide, please. USAID has always been at the forefront of developing innovative financing approaches to support access to clean water supply and sanitation. And recognizing the constraints to household sanitation access, USAID, Water.org, and UNICEF have jointly designed a new concept to provide a local solution called output-based ed and blended finance for household sanitation. This approach uses public grants for target subsidies to leverage equity or cost share of households belonging to the lowest segment of the poor population, making wash service affordable to these households. OBABF is one of the financing schemes that operationalizes the principles of the Philippine government's financing policy for the water supply and sanitation sector, referred to as the Unified Resource Allocation Framework. This framework espouses targeted subsidies, leveraging of public with private resources, and use of market-based financing for economically and financially viable projects. We will explain in more detail in the upcoming slides. Next slide, please. Apart from making sanitary toilets affordable for poor households, there are a multitude of benefits from implementing OBABF, and I would like to highlight a few. OBABF is results-based, so the risk of subsidy misuse is eliminated since funds will not be disbursed until the facility is built according to standards. Second, with the grant loan mix, microfinance institutions are able to expand their market to other members of the population. The homeowners also tend to have a strong sense of ownership and take good care of their toilet facility as beneficiaries with equity. And finally, having one's own toilet facility fosters human dignity, security, and privacy. Now I turn you over to Ms. Doreen Erfe, Resource Mobilization Specialist of USAID, to share more details about the pilot activity.
Thank you, Joanne. From here on, I will discuss our experience with the pilot implementation under the USAID Safe Water Project. USAID implementing partner DAI and ASA Philippines, a local MFI, provided grants to make the pilot program possible. To simplify the pilot implementation, we decided to use the grant funding for the construction of septic tanks, which are the primary treatment units, thus critical for reducing pollution load and addressing public health concerns. We designed the prototype to ensure compliance with national standards. Regarding our MFI partners, ASA Philippines and Negros Women for Tomorrow Foundation, both are leading proponents of WASH loan programs. They actively participated in the consultations on the OBABF concept design, and both are strong believers in the value proposition of the OBABF scheme. We selected 2 municipalities where Safe Water operates, specifically Sagay City and Negros Occidental, and Alabel City and Alabel Municipality in Sarangani. The choice was based on the following criteria: poverty incidence, level of access, incidence of waterborne diseases, and commitment of the LGUs. For beneficiary households, these were the criteria used. They belong to the bottom 50% of poor households they do not have a toilet at all or have unimproved toilets only, like open pit latrines, and are willing to put in their cost contribution for the superstructure in the toilet bowl. In the case of Sagay City, another factor that we considered is the dependence of the island community on ecotourism for their livelihood, which is adversely affected by poor sanitation practices. Next slide, please. This slide shows you the process of the OBADF, some of which can be done in parallel. First step, the LGU identifies the beneficiary households using the National Household Targeting System used for the Conditional Cash Transfer Program or using local official databases. Next, the LGU allocates the budget for the subsidy. And the amount of the subsidy may be based on affordability or simplified to cover the cost of the septic tank. LGUs will put the budget in a special account akin to an escrow account to ensure that the funds are not fungible for other uses. Third, the LGU enters into partnerships with MFIs, and the MFIs will advance the total cost of the toilets, bear the construction risk, and compliance with prescribed standards, and the credit risk of household borrowers, and not to mention the political risk related to full and timely reimbursement of the subsidy component. Next, the LGU and MFIs promote OBADF program with the target households. Fifth, the LGU selects beneficiary households and issues vouchers as proof of the grant. The vouchers prescribe the standards of the septic tank and a prototype design. The MFIs can then market their loan program to the households. And the amount of loan will depend on the preference of the household with the materials and size of the superstructure. Step 6, once the loan agreements are signed, the MFIs manage the construction to ensure toilets are built expediently and according to standards. Next, a third party verifies the construction of the septic tank according to standards and the completion of the toilet. And lastly, after verification, the MFIs apply for reimbursement. Next slide, please. The pie chart shows you the funding mobilized for the pilot. We had $45,000 cash grant, $8,000 mostly in-kind contributions from LGU partners, and household equity. With the cash grant, we were able to construct 100 toilets benefiting 500 persons. And the pilot program showed that although the subsidy for the septic tank is higher than the usual provision for toilet bowls and construction materials, the OBADF demonstrated 100% efficiency. So in contrast with the usual scheme, only a small percentage of the households who received toilet bowls and construction materials actually built toilets, much less complied with the standards. So let me show you a short video of the pilot implementation.
Ako si Jessica Mikoy, nagpuyo sa Purok Bitos. Diri sa Purok Bitos, problema mi sa among CR kay ang tubig babaw kaayo. Lisod kaayo magpahimo kag CR. Ang amo ang ginalikayan kung halimbawa pares ana magsakit.
Mao ni among CR. Mao ni among CR nag-agwanta na lang gid mi nga ani ma'am kay wala gid mi ka kuan kanang wala gid mi ka
wala may ikapalit.
Oh, ikapalit.
Come up kami, nag-training o pag-uusap doon sa mga mason para ma-explain namin kung paano siya ay construct ang septic tank, kasama na rin yung comfort room.
Kalipay namo na kay para iwas sa mga sakit or unsa nang kuan sa mga bata.
Ada ko kay ni matabang sa muamam kay
Ligon among kuan, ligon among septic tank nga. Kanang habang buhay na gid siya kuan ma'am, kanang magamit ba. Nindot na gud among pag CR, dili na makita namong mga ulo.
Okay, next slide, please. What we have learned from the pilot implementation, women showed the most interest, citing families' health, security, privacy, and convenience as their reasons for wanting their sanitary toilet. Demand for toilets is high, but affordability of up cost front bars household from getting one. And the pilot demonstrated efficiency and value for money. And the collateral benefit of the program is the livelihood opportunities for masons trained under the program. And next step, Next slide, please. Here are the next steps to be undertaken by the project. So we'll just flash it. Thank you very much.
Thank you, Joanne, and thank you, Doreen, for that very interesting presentation. Certainly, there will be a lot of interest in the audience, and perhaps I also have some questions. We'll come back to that towards the end of the session. Let me now start. Let me move to the next speaker, Mr. Riyad Imam Mahood, who's the co-founder of Managing Director, Country Director for Max Social Enterprises, Max Foundation in Bangladesh and Nepal. He will be speaking on connecting the rural unserved to safe water at home with local entrepreneurship. Riyad is the country director at Max Foundation since 2012, and is also the co-founder and managing director of Max Social Enterprise, a spin-off piped water business since 2019. He has led the organization to reach 3 million people with significant impact on reduction of child stunting from 51% to as low as 25% between 2016 and 2021 through signature projects that he's been working on. He brings passion for evidence and market-based solutions to integrated WASH nutrition approaches. He has a degree in agriculture engineering, a master's in international economic relations, and a master's in public health and water resource development. He's got 20 years plus experience in WASH, nutrition, public health engineering, and has worked with government bodies, donors, and NGOs. Riyad, over to you.
Thank you very much for giving me the opportunity, and I would like to welcome to my presentation from Bangladesh. Very good morning and good afternoon to the audience who are listening to us. The topic is connecting the rural unserved to safe water at home with local entrepreneurship. I will explain the case of our Max type of experience, the social safe water enterprise that we developed in Bangladesh. It is a great problem that is achieving universal water services in Bangladesh, where the solution is totally based on government or NGO services. And social business is demanding solution for universal water services. Here, the max tap water model I explained here at how the pipe water supply for climate resilience it can be used, and bringing in private financing through the local water entrepreneurship, and promoting women entrepreneurship and local solution, social inclusion in this area, and multiply effect of social on social issues and universal sanitation and hygiene, and also the closing gap between the public and private services. If we see the progress in Bangladesh in last few decades, particularly in last decade, it's a tremendous growth in Bangladesh economy. It's fast growing country now, and also a lot of improvement in safe water access. But still 5% rural household have only other options are not there. Only 5% have using pipe water service at home, and resilience on tube wells and very much reliance on tube well. Particularly they are using hand tube wells, and source are unsafe and quite far away because of arsenic and other bacteriological contamination in hand tube wells. Women and girls bear the water burden. In fact, they use a lot of time, more than 90 minutes, and sexual harassment is very common. On the other hand, NGO and public-based models are often failed to operate. Particularly, these are financially unsustainable in many cases. So while we are thinking about a long-term successful water solution, then we think, okay, let's bring the private sector experience in the social arena with water supply. So safe water enterprise, we learned that it can complement public service. On the other hand, using a market-based approach to deliver services, able to use decentralized solution. NGOs and some government programs have short-term funding cycles, but business have longer period. So until it's successful, it continues. So why social business we need? Actually, to target financial sustainability and social impact. On the other hand, if we see that water margin are very small and equitable coverage, so we need a lot of patent capital. This capital is not like just direct investment and profit. It is also need a resting period, also involvement of the people and participation. So profit need to be reabsorbed or regenerated for new business cases so that it can continue with its profit and in the longer time with better impact. Now, if we see how we are managing this tap water company, so we have the companies like social enterprise, we have some investment that we take from investors. On the other hand, we also involve the local entrepreneur as a co-investor in the local level, and they also get an interest and they get operator fees from the grids that we earn the revenue. On the other hand, the extra revenue that absorbed in the max social enterprise for its operating cost. And then we provide a 24/7 water supply services by taking a monthly tariff and a connection fee. Connection fee we take one time and monthly tariff is every month. So people, we have a lot of study and experience that people have a willingness for better services. And we develop low cost and low tech grids. And monthly tariff are in such a way that the people are comfortable to pay it. So it's a 24/7 good quality water supply and customer skill. We also have a customer care where we train plumber and masons to support them instantly within 2 hours call. And our break-even period is estimated 6 to 7 years. Now we see that pipe water service offer customer private resilient water access. This is always a big challenge when we are working in the coastal areas, raising sea level, erosion, flood, cyclones, salinity make a traditional water source inaccessible many times. But pipe water allows people access even during the floods and also able to reach deep aquifer without a saline. This is a big question that why we are just using the deep aquifer, why we are not thinking about rainwater or why we are not thinking about safe surface water. Yes, we are thinking, but we are looking for a better and affordable technology for that and also developing the sources. So we are flexible to use rainwater and also surface water treatment for upcoming days. But now we took the easiest way because we have to start the business and to create a business case first, then encourage the private sector to go beyond the situation. Now, pipe water access have multiplier effect on improving household sanitation. This is a great experience. We learned that when water is connected, it triggers the household to invest more in sanitation also because they don't use a direct pit latrine in that case. They use better latrine that we call septic pit or a flush or a septic chambers. These are kind of in the construction they are doing. That's also additional investment there, almost 107 US dollar by the improved water supply for sanitation and creates additional business for sanitation micro entrepreneurs. So this is a kind of interrelation in economic of water, economics of sanitation. Max tap water promotes gender equity also in social inclusion. That is because we reduce water burden, so it create extra opportunity for economic and educational opportunity for the women and children also, safety and dignity for the woman. And we also create women operator entrepreneurs. That's why we train them and we try to develop. They come in business and also in the sanitation, water business and marketing. Easy access for elderly and people living with disability because there's a tap inside home. They can even disabled people can use it without anyone's support. Here, if we see SDG 6 target, and we also know there is a big gap in last study by IFC in 2019, it showed that in water and sanitation, there are $410 billion. So it's a significant that there is a need of investment from the private sector. In Bangladesh, we are graduating into middle income country very soon, and it's a great situation that Bangladesh is really changing a lot positively, economically, socially. So there is an opportunity to grow more. Here, we see that 385 million USD are invested by the user, and the rest are by the government and also external. So it's a replacement we are thinking to invest more from the user and also from the private sector to reduce the pressure from the government, but government also need to be participate in the public-private partnership systems. So this is a kind of opportunity that we are looking for by giving this example of social worker business. A local entrepreneur, if you see that they are bringing a lot of co-investment, and they are also a big contributor and what you call the instrumental for this service, and 10 to 12% investment they do for the hardware, and it's a return for 5 year 18% annual return, which is much higher than any bank investment, any bond, anything. So this is another opportunity that people can invest there if the business can be trustful. So we want to ensure local ownership. Challenges there, of course, there access to finance, COVID economic shock, and also rural investor also sometimes a lot of loss they've had in last 2 years. Women entrepreneurship did not grow properly because of education and the COVID. They could not go out even. So we are proposing institutional support so that the social safe water enterprise can grow in a country, and one-stop service by the government also provided. Investment from banks and also investment model together with local entrepreneurs as the local investor. Yeah. So local scaling up is also very important here. If we see Bangladesh government have a kind of a mindset, political agenda also that Bangladesh government want to turn out every village with the services like cities or towns. So it's a kind of my village, my town agenda that implementing by the government is very comprehensive to this approach. If people have piped supply in villages, then it is very possible. On the other hand, customer-centric market-based approach can be aided by the government initiative, and Max Tapwater offers an example how public and private financing can come together as a universal wash access. So this is the end of my presentation. Now I'm open to for your questions. Thank you. And obviously, this is the 15th August is upcoming, and it's our honest and gratitude to our father of the nation, Bangabandhu Sheikh Mujibur Rahman. Thank you very much.
Riyad, thank you very much for a very interesting presentation, particularly the model that uses local entrepreneurs for wash access. So I'm sure there will be questions that we'll come to. Let me move on to our next speaker and introduce Ms. Upasana Yadav, who is the program lead for Center for Water and Sanitation. Upasana has been associated with CWS since 2014. He has extensive experience in wash and urban development sector. He leads the center's work in implementation of city sanitation plans, wash improvement and planning tools, and innovative financing mechanisms like development of impact bonds and blended finance solutions and mechanism. He also has experience in border security, performance assessment systems, public finance, and business model. He has a master's in planning in housing from CEP University Ahmedabad, and has a bachelor's in civil engineering from Maharaja Sayaji Rao University in Vadodara. Upasana will speak on development impact bond for urban sanitation. Upasana, the floor is yours.
Thank you so much, and good afternoon, everyone. It's been a pleasure to present on the topic of development impact bond for urban sanitation. So as we all know that it's just been 8 years left in order to achieve the sustainable development goal target, but we are far behind that, with the sanitation being the most critical one. And hence, various development partners and experts are exploring various innovative financing mechanisms in order to close the financing gap. And development impact bond is one such financing instrument. So development impact bond, or the DIPS as we generally called it, is a result-based financing instrument that focuses more on outcomes. It also helps to attract the risk investors, which are not only looking for the commercial returns, but also for the social outcomes. DIPS have been quite famous in education and health sector, but not so much in sanitation sector. And hence we are exploring that how we can develop a DIP structure for urban sanitation. Yeah. So in India, as most of you would be knowing, that it has been an effort for last 8 to 10 years through the national program called Swachh Bharat Mission, that India has been able to achieve the open defecation free in year 2019. And most of households are now connected with either the individual toilets or through a shared public or community toilets. But the need or the time now is to look beyond the toilet part and to look at the entire service chain, especially looking at the conveyance of the waste and the treatment of the waste that has been generated through these toilets. Uh, in India, if we look at the sewerage systems or the STPs are mostly been located in the large cities. The small cities are about 60% of India is still dependent on on-site sanitation system, which we called as a septic tank. Generally, the septic tank needs to be desludged regularly, but generally people don't desludge. It's been desludged like in 8 to 10 years or never been desludged. And the waste that is being collected from the septic tanks are not treated. Around 70 to 80% of the sewerage that is being generated are being left untreated, posing the several environment and health issues. The efforts are now being taken by several state governments and national governments to build the treatment system in the cities, even being the smallest one. The issue with the non-desludging of the septic tank is that the sludge get hardens, and generally one needs to involve the manual labor to remove that, which is banned in India, and hence we have seen that there is a lot of health impact and environment impact that is being generated if we are not taking care of the entire service chain. So, what we are proposing under the Development Impact Bond is an integrated approach, which will be inclusive, and inclusive means inclusive of poor and all the residents of the city, and also the services which is affordable to the people so that it's sustainable in the long run. So, as I mentioned, that some of the challenges that we have seen in the fecal sludge systems are the people generally don't know that they have to desludge their septic tanks in 3 to 5 years. And hence, there are accidental events when the fecal sludge overflows from the septic tanks into the open rivers and causing the several health problems. Hence, what we are proposing is that all the septic tanks in the city should be emptied on a regular cycle, that is either 3 years or 5 years, and this service should be provided to all the residents of the house, all the residents of the cities, and at an affordable cost. The second challenge, as I had mentioned, is that there is a lack of adequate treatment plants. The waste that is being generated are mostly been left in open or sometimes been dumped even in the river bodies, and hence a system to have a safe transportation and treatment of this fecal sludge is needed in order to achieve the healthy community and environment. The private investment, especially in the treatment and the conveyance part, have been very less. There are informal players which are active, but we have seen that there is not business prospects, and hence through this step we are also proposing that we could develop a more sustainable financing models and help attract the private investments in the sectors, which can be scaled up later on across various cities and states in India. The other thing that we are proposing is that we will also build the capacity of the local government in order to sustain the service, which will be both financially and technically they will be able to sustain through their own sources. So what I have proposed, what we are proposing is we have already tested this in the cities of Vai and Sinnar. So that is something which has already been tested. So in Vai and Sinnar cities of Maharashtra, the cities have engaged the private service providers and have declared the policy of scheduled desludging of septic tanks, which is being done in every 3 years. Also, there is a fecal treatment systems that have been set up so that all the fecal waste that is being collected is being treated properly before disposal, and they also ensure that it is properly reused. In addition to that, it is important to measure and monitor the outcomes of the program, and hence we have also developed the online monitoring systems which could easily track the outcomes that has been generated through this program. And through this program, we are also ensuring that there is a proper PPE usage. Generally, we have found that the private players who are involved are not using the PPEs properly, and hence to ensure the safety of sanitation workers, we are ensuring that in the contracts, the proper terms and conditions are being added, and more awareness drives are being created for the use of the PPE. The outcomes that were came out from the successful models of Y and Sinner is that, so before there were only like 7 to 8 septic tanks that were emptied in 1 month. But now with the scheduled desludging, they are able to empty 7 to 8 septic tanks per day. And we have achieved, so in Y we have completed the 1 year cycle, 3 year cycle of a scheduled desludging, and all the households are being covered in the 3 year cycle. The other thing is that we have almost covered around 4,000 properties through the scheduled desludging. And also, since we have introduced scheduled desludging, and with the operation being most optimal, the prices for the services came down literally very less, and people were able to afford the service. We introduced the concept of sanitation tax in the cities. During the time of desludging, the residents do not have to pay anything to the local government. It will be included in their annual tax. So they generally consider this as a free services, and hence there were a greater acceptance rate in the city. And we have been able to treat all the fecal waste, around 20 million in over the 3 year duration. So in order to scale up the experience of Y and Sinner to other cities and across the state, and also to explore the different business models that to bring in the more innovative concept, we are exploring a development impact bond. So we are proposing to scale this across the 15 cities in the Maharashtra, which could impact around 0.8 million people. And the bond structure is a simple structure. We have kept it very simple, that an impact investors will be providing an upfront working capital to the sanitation bond entity, which will be an NGO, and the sanitation bond entity will be working with the local government and private service providers in the city to build their capacities to bring the online monitoring systems, and to develop the system so that it's more sustainable in the long run, to ensure that the outcomes which are envisaged under the DIPS are achieved. And through an independent monitoring agency, we will be evaluating the outcomes of the project. And if the outcomes are achieved, the outcome funder will pay to the impact investors the capital amount as well as additional returns. The bond size that we have envisaged is 1 million bond, and we are also through this bond we will be able to leverage the cost from the local government, which will be 2x of the bond cost. So as we move to the next slide, we know that since DIB is an outcome based structures, we have defined that what could be the outcome measures that can be monitored through the entire DIP structures. And we will also propose the use of the online monitoring systems that we have successfully used in the 2 cities. So it's a very simple mobile-based application, just like an Amazon. So if your service are received, the household or the residents will pay for the services. So through the DIP will have a wide-ranging impact, ranging from the most obvious one on the health and the environment, as with the improved sanitation services, to the social and economic benefits also. It will be ensured that the safely managed sanitation services will be reaching to all the households, including poor, as well as affordable to them. And through this DIP, we will also be creating the livelihood opportunities for the private service providers, as well as a community group called as a self-help group. So if we look at the key learnings from the DIP structures that we have developed and the initial conversations we had with the impact investors and the risk investors, we could see that there is a lot of interest among the risk investors, because they also want to invest in the outcomes or the outcomes for the social problems that are there. But we found that generally it's very difficult to get the outcome funders, especially with the changing legal laws and not so enabling environment. So I think also there is a general perception that we have seen that the dips are very complex and expensive to develop. And hence we have tried to keep the dip structure very simple so that it can be flexible and it can be also scalable as per the requirement of different stakeholders. So I think through div, it is also important to know that generally in sanitation, the outcomes are generally not measures, or people say that the environment and health outcomes are very difficult. But we say that the small outputs can be easily measurable, which will also help achieve the larger goals of environment and health outcomes. So we hope that in the future, we will be able to implement the DIP and it will act as a model case, because generally the DIPs have been quite famous in education and health, but not so much in sanitation. So it will also help the future potential investors to bring in more confidence in the sectors and bring in more private investment. So yeah, thank you.
Thank you, Upasana. That was a very interesting presentation, particularly highlighting on the sustainable financing options. In fact, your presentation probably will elicit a lot of queries from our audience, and perhaps we wait to hear more from them. Let me now move on to our next presentation, which is going to be a video recording. Unfortunately, the presenter Suraja Raj from Emory University is not able to do a live presentation, and she will be speaking on the use of SaniPath tool to identify key pathways of exposure to fecal contamination, with a case study presentation from Dhaka, Bangladesh. So may I request Gino perhaps to start the video recording of Ms. Suraja Raj. Thank you.
Hello, my name is Suraja Raj, and I'm presenting on behalf of a team at the Center for Global Safe Water, Sanitation, and Hygiene at Emory University. Today, I'll be presenting on the use of the SaniPath tool to identify key pathways of exposure to fecal contamination with a case study from Dhaka, Bangladesh. I apologize that I'm not able to present these slides live due to the time difference. However, I welcome questions and comments via email and on Twitter. I've included my information on the slide. As most of you already know, sanitation is a global problem, from open sewage and inadequate sanitation systems to developing local expertise on mitigating the spread of pathogens. One component of this challenge is that the capacity for collecting public health data and effective translation of existing data into action is limited. Conducting exposure assessments can help address this challenge. Health outcomes can be difficult and costly to measure, and exposure assessments, which measure the risk of exposure to contamination in the environment before someone becomes ill, can provide valuable information. They can identify relevant and dominant pathways of exposure, essentially those pathways that are most likely to contribute to risk, and it can also help understand the drivers of risk, either behavior or contamination. The information can be used to prioritize programs and investments based on where you're most likely to have public health impact. Our team has used our expertise in exposure assessment to develop the SaniPath exposure assessment tool. The SaniPath tool was designed to help making conducting exposure assessments in urban areas easier. It assesses public health risks related to poor sanitation and fecal sludge management, raises awareness about these risks, and helps prioritize investments based on exposures that, if mitigated, are likely to have the greatest health impact. The tool looks at exposures within a community across multiple different transmission pathways, as shown in the diagram. They include drinking water, surface waters, open drains, public toilets, floodwaters, bathing water, raw produce, street food, and soil. SaniPath is unique as it's one of the few tools focused on public health, and it involves primary data collection. If you think of sanitation tools as either A, diagnostic tools, B, prioritization tools, or C, planning and technology choice tools, SaniPath could be described as sitting between diagnostic and prioritization tools. We often like to describe SaniPath as picking up where other diagnostic tools, such as the shit flows diagram, leave off by helping users understanding the exposures from unsafely managed excreta identified from the SFD that end up back in the residential environment. It can also complement and fit within the framework of other prioritization tools, such as the Sanitation Safety Plan, as it's a targeted tool to identify neighborhood level path exposures from different pathways. It's a tool ideally deployed before planning and technology choice tools, as it can guide those tools focused on choosing appropriate technological solutions or complement information on cost effectiveness, etc. The tool uses a standardized and simplified method for data collection, and the process of the tool is outlined here. It starts with a preliminary assessment to better understand context and customize the tool, and then guides the mean and behavioral environmental data collection, and ends with automatically generating risk profiles and a final report. SaniPath tool interface is used to manage collection, analysis, and reporting, and all are automated. The tool collects two kinds of data: behavioral exposure data and data on environmental fecal contamination. Data and behavior are collected using surveys of reported frequency of specific behaviors of adults and children that may lead to exposure to fecal contamination. For example, the type of water people drink or how often they may have contact with drains. And this data are collected through household, school, and community surveys. Data from locations and magnitude of fecal contamination in the environment are collected by taking samples from each relevant exposure pathway and then analyzing those samples for E. coli, which is a common microbial indicator of fecal contamination. The pictures from the field show how users have been able to adopt mobile data collection and conduct surveys and laboratory work easily in the field. Behavioral data from surveys, the environmental data from laboratories, analysis of samples, and parameters from the literature and other studies are combined to provide an estimate of the dose of exposure and percent exposed in a population. Result are these people plots, which are featured in the center and depict exposure through two components: the proportion of people exposed, shown as the number of red people in the figure, and then the dose or concentration of E. coli ingested per month, as depicted by the darkness of the red color. We also built a platform for the tool, which is where users can go to select the appropriate pathways for their local context and customize the mobile forms that will be used on Kobo Toolbox for mobile data collection of all behavioral, environmental, and lab data. These data are then uploaded to a server on the Amazon Web Service Cloud, and then they can be monitored and analyzed from the dashboard, and users can auto-generate the people plots, histograms, and pie charts, as well as generate a report with background information and guidance for the interpretation of the results. And all the tools and protocols and guidance are open source and freely available on our website, sanipath.org. To date, we've supported institutions deploying the SaniPath tool in 10 countries, 11 cities, and 48 neighborhoods, as shown on this map, not including Durban, South Africa, where deployment was interrupted due to the COVID-19 pandemic. We've also supported several cities in building on the base of the SaniPath tool to test specifically for certain pathogens. For example, Vibrio cholera in Nairobi, Kenya, and Salmonella typhi and Paratyphi A in Kolkata, India. In 2017, we supported a deployment of the SaniPath tool with the World Bank and ICDDRB in 10 neighborhoods across Dhaka's North and South City Corporation. This chart shows the total exposures on the left and risk of exposures from different pathways shown in the different colors. The key finding from the assessment were that produce and street food were highly contaminated and frequently consumed across the city in all neighborhoods, regardless of socioeconomic status. We also see that municipal drinking water is a dominant pathway in 2 neighborhoods, and in some areas, floodwater and open drains contribute greatly to exposure. And this is concerning because these pathways can move contamination throughout a city and a community. All dominant pathways are driven both by high contamination and high frequency of exposure, and there were important differences between risks for adults and children. Sanipath's risk-based approaches can support citywide inclusive sanitation initiatives by helping customize and prioritize sanitation investments in cities for equitable and inclusive access to sanitation. It identifies the needs of marginalized communities and can provide details and gaps in the sanitation chain where waste is discharged into the environment. Despite efforts to engage key stakeholders, limited action was taken based on the data in Dhaka, likely due to local politics. However, we have learned valuable lessons about consistent engagement of local stakeholders and identify local champions to serve as advocates throughout the process. I want to share some examples of how Sanipath services have led to action in other places. In Zambia, Sanipath provided technical support and training for conducting exposure assessment of various environmental pathways to understand risk factors for seasonal cholera outbreaks in Lusaka, Zambia. The results provided the local city council with the evidence to support their actions to bury shallow wells in the wake of their 2018 cholera outbreak, and results also helped inform cholera messaging campaigns. We've also conducted a number of trainings virtually on Sanipath methodologies, including one with the Center for Science of Environment in India, where we trained environmental health workers and sanitation practitioners in public health assessment principles. And lastly, in Ghana, based on the results of Sanipath assessments, we supported the translation of exposure assessment results and advised the development of food safety guidelines released by the Ministry of Local Government and Rural Development in Ghana. Lastly, this work would not be possible without the effort for all our team members and partners. Thank you.
Thank you. That was a very interesting presentation. I'm afraid that she was not able to join live given the time zone differences, but the tool seems very interesting. Moving on to the final presentation in the panel today. It's a pleasure to invite ADB colleague Chang Jiang to make the presentation on Baguio Resilient City Tourism Project. Chang is a senior urban development specialist at the Urban Water Division in Southeast Asia Department of ADB. He has a master's degree in environmental management from the National Institute of Singapore and a master's degree in urban planning and policy design from the Politecnico di Milano. Chang has been working on urban planning and urban development, water resource management and solid waste management, and biodiversity and conservation and community-based forest management in Southeast Asia for over 15 years. More recently, she has been engaging with developing resilient cities and tourism projects in Lao PDR and here in the Philippines. So Chang, over to you for presenting the Baguio project.
Thank you so much, Srini, and my pleasure to be here. Good morning, good afternoon, all colleagues and the audience who are attending the event today. I have the advantage of being the last presenter in this series of presentations that you've heard. And I can really see there is alignment. Joanna presented the current situation in the Philippines at the national level. So that is a very nice framework for me to work on. Similarly, Upasana talked about the situation in India with the issues of sanitation, the lack of desludging services. So this is something that I already find that we have in common. So this is just a quick overview of what our project is trying to achieve in a city called Baguio in northern Philippines. We are working on a project called Resilient City Tourism Project in Baguio City. And we are discussing today sanitation. However, as you can see, there is a very strong linkages between basic services and economic development, especially in the tourism sector. We are aiming to achieve regular dislodging services for all the people in Baguio City, which is over 80,000 households, with a frequency of once every 4 years. We also improving or increasing the treatment capacity, and this is for both sewage and septic, to ensure, and that's not only the quantity, but also the quality, to ensure compliance with relevant environmental guidelines. We're working on adding 15,000 households to the existing sewer system with some upgrading of the system as well. And very importantly, the last 2 points, we will improve the financial sustainability of the systems as well as strengthen the institutions, especially the local government, as capacity to deliver these services. A snapshot about Baguio City. If you are Filipino, I'm sure you know it very well. What is special about the city is that it has experienced very rapid urbanization and hilly topography. It's a mountainous area. With the elevation, is considered the summer capital of the Philippines. It's very popular amongst tourists. So as you can see on the chart here, the resident population has been relatively stable the last 10 years, but the tourist population has doubled. This is pre-COVID data. And the design of the treatment will have to look at these characteristics of the city. Because it's mountainous, there are very few available land for us to develop infrastructure in the city, and that's one of the constraints that we need to work with. There are also facilities that are difficult to access, and because again of this terrain, the basic services such as water supply and discharging services are very expensive. This chart shows the current situation between septic and sewage. So 90% of the residents are still dependent on sanitation, on septic tanks. And about 10% of the populations have access to a sewer network. In addition, there is a small amount, less than 1% of the residents are using the communal septic tanks, but the majority, as you can see, are still using individual household septic tanks. And this the septic is transported, if it's dislodged, is transported to a septic treatment plant with a capacity of 20 cubic meters a day, and the sewage is treated at a facility with a capacity of 8,600 cubic meters a day. We did a survey in 2020 of 1,000 households, and this map represented the results, a snapshot of the result of that survey. So all the orange dots or the brown dots that you can see are those septic tanks that were surveyed but were never emptied. And the green ones are those that were emptied. So overwhelmingly, as you can see, very few households actually empty their tank, and they did it when there was a problem. By law, they need to do this every 4 years. And this service is on demand. It's not scheduled, as was discussed before, and is provided mainly by the private sector, but the city is also participating or providing this kind of service. On average, it takes almost 10 years for people to empty their tank, and this is a big problem, as explained earlier. This is causing, obviously, a threat to public health as well as to the environment. You can see on the map here, there's a river called the Balili River, and this is one of the most polluted rivers in the Philippines. Unfortunately, it's also in a very popular tourist destination. So this is something that we need to address. In addition to the problem with the lack of desludging, we also see another issue, which is inequality between those that are connected to the sewer network and those that are using on-site sanitation services. So because of the lack of a billing system, of a database, currently households that are connected to the sewer network are using it for free. They're not paying. The city has a draft regulation to request payment, but even if that payment is imposed, there is still a very large gap between the cost or the price of those that are using on-site sanitation and those that are connected to sewer network by 7 times, because the households that are using individual septic tanks have to pay for the tanks to be built, and then for the dislodging services, and then for the treatment of the septic as well, while the others are paying very little. Overall, there's also lack of budget for the city to provide universal and efficient sanitation for the entire city. This summarizes what I have mentioned before about how fecal sludge is being managed in the city. So I believe that many of you are familiar with this fecal sludge flow diagram with the green lines, representing the fecal sludge that is being safely managed, and the red lines presenting those that are not safely managed. So overwhelmingly, almost 80% of the fecal sludge in the city is not safely managed. And that explains the issue with pollution that we're seeing in the river, but I'm sure also with groundwater as well. So with that, what is the city doing to address this problem? First of all, they recognize that this is something they need to work on. They have, with IDB support, prepared a fecal sludge management plan 2021-2050 with the aim to guide the cities to deliver fecal sludge management services in an efficient, equitable, and sustainable way to improve environmental and public health. And as you can see in the objective, this is very much in line with the citywide inclusive sanitation approach that ADB and other development partners have been pursuing. Within this plan, there's an action plan with associated budget for immediate, short, medium, and long terms. We are already supporting the city with a technical assistance to initiate implementation of this plan. And this plan was officially approved by the city in 2021. On this slide, I'm showing the work that ADB is supporting the city and the work the city is already doing on their own. So on the left-hand side, with this diagram, you see the four-pronged or multi-pronged approach that we are taking in the project. With the top right corner, this is more about infrastructure. So we are increasing the capacity for both septic and sewage treatment plant. For septic, we'll increase it by 4 times, and for sewage, we'll double the capacity. And as I said, we also support the quality of that. We're also working on schedule desludging, as well as sanitation tariff and a behavioral change campaign. The city is working on a community-based monitoring system, which will provide powerful data for us to continue this support. So to conclude, there are many advantages that we're experiencing with Baguio City with their own initiatives. But most notably, we have a really committed and very progressive city mayor that is working as a champion for us. And I would say that's the most important factor for us to make all these innovative changes. On the other hand, the city is also experiencing a lot of challenges that are unique. For example, it's a mountainous area, the cost, and within the Philippines, as you may know, autonomy is not always balanced with resources and capacity. And this is where we really have to assist the city at the local level with a project that ADB is providing. Thank you very much.
Chang, thank you very much for a very interesting presentation on Baguio. I'm sure, again, there will be questions, perhaps. I already see a number of questions that have been posted on the question moderator view. I'm done looking at. What I intend to do, we're good on time. I think first of all, thank you very much for all the speakers for sticking to the time, so we will have enough time for the Q&A. There are some of the questions which are directly addressed to some of the speakers. I'll pick up a couple of them. And then there are some of them that I would really throw it open for any one of you to respond to, because they are cross-cutting, but they're very important and very interesting questions. So maybe I'll start with the first one, and perhaps bring Joanne, if I may start with you. The question this was asked was about the use of the independent verification agent. My colleague Alison Woodruff wants to know how, or rather, who was that entity that conducted this verification? And secondly, from the pilot that you've done, what changes would you be proposing to OBA model so that the impact will be more amplified? Joanne, over to you.
Thank you. Thank you for those questions. So for the first question about the independent verification agent, so based on the pilot experience of Safe Water, the independent verifier was the sanitation health inspector. But outside of the pilot, and if this will be pursued by other LGUs or local governments, they can also tie up with non-government organizations or academic institutions as other options for independent verifier. On the second question, there are two possible entry points that design can be, adjusted or improved. One entry point would be the implementing entity. Right now, based on the experience, we are working directly with the local government units of Sagay and Alabel. But this program can also be adopted or implemented at the national level. At the subnational level, provincial governments can play a role in implementing OBABF. And then the second entry point would be the technical aspects. So when the construction or prior to the construction in Suyak Island, for example, or Alabel, if it was discovered that there are nuances or unique aspects in the geographical characteristics of the sites. For example, some sites would have a high water table, or there would be issues with space constraints. And so when you construct the septic tank, these things, the geographical characteristics will have to be taken into account. So for example, the structure can be reinforced with, slabs and other steel works, or for example, elevating the septic tank to a higher ground so that water seepage will be avoided. And for those households that are built very close to each other, they can opt for a shared septic tank as part of the technical design of the structure. So I'll stop there. Thank you very much.
Thank you, Joanne. This is very, very good feedback. In fact, I was reminded of the Global Partnership for Output-Based Aid, which has also developed some mechanics through which private sector micro enterprises who have been able to come and work at the community level, through which the collection of tariff is done, and then that's kind of then managed at the community level. So certainly, I think output-based aid would certainly be a very important tool for increasing the reach of sanitation, particularly in difficult to penetrate areas like the examples that you mentioned. Thanks for the response. So I'm going to go to the next question, and this is perhaps I would like to invite anyone among the speakers. It is a very critical question, and one which is wide-ranging, that's been asked by Bilal, which is what he's saying is that all the solutions presented are tested and mostly have failed in developing world. Desludging is done in most unhygienic way, if ever done, as we saw in some of the examples. The next step of treatment and safe disposal is a bigger challenge than is. We should propose technologies with minimum human contact to make it a closed loop solution. So that's the comment. And then I guess also a question that's been raised by Bilal. I'm wondering if any of the speakers would like to reflect on this, perhaps. Who would like to go?
I think I could respond to that.
Sure, Upasana,
I think it's also important to understand that why desludging is being considered as not so hygienic conditions. Generally, because in the small towns, what we have seen is that the septic tanks are being emptied like 8 to 10 years. And generally, when they do that, the toilets are being not in use. The toilets are choked. So what we have found that during this duration, the sludge gets so hardened that even with the mechanical equipments and the trucks, they are not able to break it. And hence they call for the manual labor and they enter into the septic tank, and there is a lot of health impacts over there. The second reason is that when the septic tanks get choked, generally the people, private operators are there and they charge the distress price, which is so high that normally the low income households cannot afford it. And that's the situation when the manual labors and all those things comes. So I think hence, as also mentioned by Trang, I think the regular desludging so that this situation doesn't arises. Also by the services should be provided by the local government so the prices are affordable to all the residents of the city. I think if we do these two things and what we have already done in Y and Sinnar of our cities, and there are no human contacts, so that has been very clear that all the desludging will be done with the mechanical desludging trucks only, and it will be emptied in a proper treatment unit.
Thank you, Pasna.
Thanks.
Since you're on the screen, maybe I'll have another follow-up question from our colleague Christian. His question was about the legal basis for these scheduled desludging. I guess what he's coming from is that he's asking how were the LGUs or the local government convinced to apply for this program? You mentioned that the number of septic tank desludging went up exponentially, almost by 30%. So how did you or how did the private sector adapt to these new requirements, and what was the contractual arrangement to ensure that this was being done properly?
Okay, I think taking the first step, convincing the local government, I think in our bylaws, and now this has also been included in the national guidelines also, that all the septic tanks need to be desludged every 3 years. But I think explaining to the government was an important factor, that we explain that it's the service that is being provided. It's a similar service like a solid waste management, where the solid waste has been collected from all the household daily. And this has helped in reducing the waste, help in achieving the waste management. Similarly, this had to be done with the desludging services also. And they also agreed that it's important that we do not collect the fees at the time of desludging, and that it is being included in the annual tax, generally a property tax or the water annual tax, which has been collected, so that people actually take the services. And they consider this as a free service. So these were the two factors that we have considered, and I think the community were really happy. We could achieve almost 95% acceptance rate, because we were also having the awareness programs throughout the cities, that why it is important and why you need to do the desludging services. And also there was a perception that this is a free service given by the local government. So instead of paying the distress prices, let's take the opportunity. Thank you.
Thank you. Thank you for those explanations. I'm going to move on to Riyadh now. There are a couple of questions for you, Riyadh. So I'll put both of them and you could respond to them in whichever order you think it's appropriate. So the first question was about the water sources that you currently use, and what is the mitigation strategy that you have for water shortage in the event of a drought. So that was the first question for you, Riyadh. And the second question, Riyadh, was for you. What is your opinion about the water entrepreneurs awareness level in Bangladesh? Can they be the advocate for water safety and security? If not, wholesale can do on top of what NGOs and CSOs are doing. So those are two questions for you, Riyadh.
Thank you for these two questions. The first one is quite complex to answer, particularly the water source, always a big question for any water supply systems, particularly when we are using pipe water supply. And the easiest way to go for the groundwater exploration, because in Bangladesh, this is a situation where Bangladesh have enough groundwater, but in any area where the groundwater is not feasible, then of course that will be a big question. Also, in Bangladesh, groundwater exploration also is not unlimited. It needs to be limited. That's why when we are thinking to cover the whole country with pipe water supply, then the huge pressure on groundwater, which will be very, very significant, and it may have an adverse impact on the whole geological, geographical, and environmental. So that's why from the very beginning, we are considering that what can be substitute of groundwater. At this moment, we are learning a lot, and we are also experiencing that when we provide pipe water supply in communities, there are a lot of abandoned hand tube wells. The bore wells are also abandoned. Then we start thinking that how we can use this bore well for recharging the aquifer so that a dynamic system can be established, that the rainwater recharged in the aquifer, and the next year we use this rainwater from the groundwater as a groundwater. So that means we need to create a cycle of groundwater or treated surface water to kept in the groundwater as a reserve, so that it don't impact on the overall situation of the groundwater reserve and also the other impacts of higher exploration of groundwater. So this is the option we are working on, and we are also trying to recharge wells, that is the abandoned hand tube wells, bore well can be reused for recharging to create a cycle. So this is the option, but we also trying to understand the economic and engineering of these options. On the other hand, we also check the other surface water treatment are very costly, which makes the water supply system beyond affordability of the consumers. So this is another that we are looking for, low-cost surface water treatment system, so that it keeps the surface water used in the pipe water in an affordability level of the users. So this is the thing what we are taking, but our more preference to create a cycle. So surface water or groundwater, it need to be cycled with rainwater and surface water groundwater interactions. So this is one, but it also needs a lot of knowledge and study and also technical supports. Number two question was that sorry, can you repeat the question? I think I forgot it.
Sure, yeah. Let me just bring up that question. It was about the water entrepreneurs' level of awareness. How can they be better advocates for water safety and security on top of what the NGOs are already doing? So I think the question was about how do you integrate water entrepreneurs in terms of bringing them together for increasing the overall water security and water safety aspects, in addition to what the NGOs may be doing?
Yeah, we have a really interesting lesson we learned from the community, particularly when we start engaging people as an entrepreneur in water and sanitation, particularly all the women entrepreneur. The first, the challenge was that the entrepreneurship is not a practice in our rural women. Though there are entrepreneurship is not understood on this way, the common understanding about the entrepreneurship and the entrepreneurship in WASH are have a kind of difference. That's why we had to develop them. And we realized that the capacity building of the entrepreneurship need to be institutionalized. Because when we are doing, it's very NGO-based or private sector do only on their demand, but on a wider case, there is a big opportunity to create more entrepreneur, particularly women and young people to become entrepreneur in water, sanitation, and also health. Number two, our learning is that when we engage those entrepreneurs, we found they are very interested to speak to the community to create their demand. So we train them with the tools that which messages they need to give to create the demand of water and also sanitation. And that also creates additional knowledge demand for health, like nutrition and others. That's why we created HPA model, that is a health promotion agents, who are basically a local entrepreneur. They spread these messages to create their demand, and that's how they sell the connections. So that's how we are utilizing them. We found a promising opportunity that if we can nourish this, then it can be an also opportunity for the private sector to use local agents, local entrepreneurs for creating demand with health and other development messages. So that can be also reduce the pressure on civil societies. On the other hand, it can reduce the pressure on NGOs for sustainability, because when NGOs are withdrawn, then this entrepreneur can sustain and to continue this process. So this is another opportunity. And finally, we found the financial outcome of this entrepreneurship, which is really, really promising. We had a program where we tested it. It looks at the leverage or their income. We call it leverage for the project, but income in the entrepreneurs. And it is almost 130 times higher. That means if they invest $1, then they, at the end of the year, they earn $130. So that's how a big ratio. And of course, they had less competition in the beginning, but in future it will be more competitive. So the data may be changed in future, but it gives a real, really it gives an interesting opportunity to create this entrepreneurship and to make it an economic solution for water sanitation. Thank you very much.
Yeah, thank you for that very detailed explanation. I'm going to bring up another question, which I think it's an open-ended question for anyone to answer. It's also a very interesting question. The biggest challenge in sanitation solution is the final treatment. The existing technologies are either expensive or too labor-intensive. So the question is that, has anyone developed a complete system that treats waste from what the Bilal quotes as cradle to grave, particularly for the developing world? So essentially what Bilal is asking is that a kind of a fully integrated system that can deliver the outcome for final treatment also. Have you seen that being done at a cost-effective way? I have some views on this, but I would like to open it out to any of the speakers who may want to comment on this. Any takers?
Well, I can.
Go ahead, please. Yeah, thank you.
Yeah, thank you for this question, and thank you for inviting me to the panel. I was working with the chain management in Baguio. This question is also related to another question that was asked before, related to the technical solutions that failed. My personal opinion, having worked in the sector for some years now, and specifically with fecal sludge management, I'm also an engineer, is that technologies exist and work quite well. And the question is how this technology can be applied to the different contexts. And so I think if technology fails, it's either because of the context, either because of poor planning, either because of very stringent regulation. And I think we have to look at these issues to solve the issue of technology failing. And for me, the biggest example is the regulation. I'm also designing and constructing some treatment plant right now in Cambodia. And it's the discussion and dialogue with environmental authorities. Sometimes it's difficult when it comes to treatment and the quality of effluent release in the environment. And if we want to comply with very stringent regulation, yes, we have to have very modern and very costly technology, and then it will fail because probably the technology is out of reach of the financial capacity of the local authority, of the private operator, if it's private operator. So I think we have to look at the global system and looking at what the incomes can be when you develop a technology, developing proper business model, taking into consideration the different incomes that we can generate. Also making sure that we have commitment from the local authority to allocate some funding to operate the technology, and having some very well-designed contract when we delegate the operation to a private sector. And when I'm saying, just to end with this question, when I'm saying having very well-designed contract, I'm looking at the maintenance of the different infrastructure equipment. And usually it's like a gray zone. No one is responsible for the maintenance, or we don't know who is responsible for the maintenance of the different system, and no one maintains it in the proper way. And then technology fail. Thank you.
Thank you, Amede. Perhaps my next two sets of questions are either to you or to Chang. You can decide who wants to answer that. The first question is about the tariff. So the tariff, the question says, will the tariff be the same for sewered areas and the area that are being served by desludging? Is the quality of the septic tanks being monitored during the construction and after construction? So these are two separate questions.
Thank you, Srini. I'll take the first question first. Yes, we are trying to aim at equality between the different users. But I have to be cautious here because the work on the tariff is still ongoing and we are still in discussion with the local government. There are several questions to be asked about tariff. Number one, to what extent do they want to look at cost recovery? Because it's not really possible to cover both the CapEx and the OpEx usually. So is it only OpEx we're looking at or is it CapEx and OpEx? That's the first question to ask the city. We're still in discussion. The second one is that which venue do we go through? For example, Upasana was talking about real estate tax earlier. In Baguio City, I think the tendency now is to look at embedded the tariff for sanitation in the water bill. However, not the whole city is covered by the same company providing water supply. So how do we address that challenge? There are other venues for us to do, but which one would be selected by the city is the next question. And then once we go for whichever option, then we decide, on the billing and the administrative arrangements that come with it. Going back to the tariff, I think there was one question about how much is it that the tariff would be. So again, this is to be determined, but we know that the current cost for desludging is between 4,500 and 15,000 pesos. So $100 to $300 per tam. If we go for the scheduled desludging services per tam, they will have to pay about 1,200 pesos. And this is once every 4 years. So if you break it down, every month each household would have to only pay for the desludging service of 25 pesos or $50. And of course, that becomes a lot easier to deal with. So the tariff question is probably one of the most complicated because we have to know what our objectives are, what we want first before we set it. There are also certain laws in the Philippines about how much you can increase the tariff, how fast that we have to observe as well. But with that, maybe I can ask Amede if you want to add to the tariff question or the one about the monitoring the construction quality of the septic tanks. Thank you.
Thank you, Chang. I will try to be sure. Just to add something on the tariff, the main question is not that much how much will people pay, because anyway, at the end of the day, we will have to set a tariff that is affordable and acceptable for most of the residents. And the main question is how you will collect this tariff. And so we are looking for different billing mechanisms, looking at different existing databases to not create a new one. For example, through the water consumption, through electricity consumption, and through the property tax. And that's the main challenge. There's pros and cons for each of the system. The most common one is water consumption. But for example, in Baguio, most of the water is generated through deep wells. So this water wouldn't be captured through the tariff. So there's so many questions to solve before getting to the tariff. And as Cheng said, we are it's still under development. Regarding to the other question, which was, about the monitoring of the quality of septic tank. And so far, there's no monitoring of septic tanks, of the quality of septic tanks in Baguio. Actually, the construction permit are not always delivered. Only a few households have a construction permit. But developing a scheduled discharging program, it's a fantastic opportunity to start with collecting data regarding the septic tanks. And the quality of the construction of the septic tank will be hard to collect at the beginning with this program, but at least you can get some data about the access of the septic tanks, and you can already solve this issue. We're also thinking about maybe including in the tariff the possibility of building an access to the septic tank, for example, because many septic tanks doesn't have access, and it's hard to search. Thank you.
Thank you, Amede. Absolutely fascinating discussion this afternoon. So we covered a wide range of issues and also very interesting examples like using OBA to achieve wash outcomes, using local entrepreneurs in running a sustainable business. We also heard about the prospects of using development bonds, which I think is, again, a very interesting aspect. We saw a tool that is being developed, the presentation that was done on Sanipat. And then finally, we saw the opportunity to really deliver sanitation outcomes for a very large and then complex ecosystem like Baguio, which is a big destination for tourism. So I wanted to first and foremost thank all these speakers: Joanne, Doreen, Riyadh, Upasna, Suraja, who sent us a recorded message, Chang, and of course Amede for also joining for responding to the questions. I also want to thank our YPP rapporteur, Paneerselvam, for his reporting back and joining, and then also for all the audience who joined and asked some very interesting questions. And I do hope that there were a couple of questions that were also addressed to Suraja, if there is a way the organizers can take those questions back to her as well. I want to thank everyone for joining this afternoon, and I will also encourage all the audience to join the rest of the sessions in the AWF. Once again, thank you very much for joining this afternoon presentation. Thank you. Bye, everyone.